What is a rotator cuff tear? So rotator cuff is something that we're seeing a lot at the moment in the clinic, and we wrote a blog about this the other week and got a huge response. So hence the reason for filming what a rotator cuff is, and also how you can manage this yourself without the need for risky surgery in the long run. I'm Dr. Jeremy Andrews, Doctor of Chiropractic here at West Chiropractic in Surrey. So chiropractors themselves, we don't treat rotator cuffs that often. It's more the sports therapists and physiotherapists that do a great job of that here at our clinic. And we help manage the alignment around the shoulder and the neck, which obviously helps the rotator cuff heal, but actually the hands-on work, the exercises, the rehab, the shockwave therapy, the acupuncture cupping that's done by the sports therapists and physiotherapists is really, really beneficial to the soft tissue to allow that to heal better. Okay, so what is the rotator cuff? Well, the rotator cuff are 4 tendons that run from the top of the shoulder and run onto the ball part of the humerus. Humerus being that bit all the way down the arm here, and then this is the shoulder cavity around this area, which is made up of the scapula. It goes into this area here. So to attach this, you've got the rotator cuff muscles. You have what's called the infraspinators, the supraspinators, the subscapularis, and the teres minor. Now they do movements like this, so moving the arm up like that, or moving the arm up like that. They also, so they initiate that movement. The deltoid, which is a big muscle here that then takes over to do this movement. They do this movement, so they help the internal, and then external rotation is very, very good for them as well. So things that may be tricky and how you know that you've actually damaged your rotator cuff are washing your hair, so having to lift your arm up and then externally rotate, having to put your jacket on, so putting the arm in like that, so that internal rotation there. If that is painful, it's likely you may have damaged some of the rotator cuff, or starting that movement there. So if it's really tender to push like that, that can also indicate some sort of rotator cuff issue. Another thing is if you are sleeping on your side, and you all should hopefully be side sleepers. If you've seen my how to sleep video, then check that out, because that's the best position to be sleeping on, is the side. However, if you've got a rotator cuff problem, that's going to be quite tricky to do, because it puts a lot of pressure on this area. It's going to then wake you up with the pain. You have to toss and turn and sleep on a side that maybe you're not as familiar with. Most of us will sleep just on one side. So for me, I always sleep on my right side. If I was to damage my rotator cuff, then obviously that's going to cause problems. I'm going to have to move on to the left side, which I'm not as familiar with, and that can cause sleep disturbances as well. So how do we fix a rotator cuff? Or, well, let me go through some things first about what we do here in the clinic to help with rotator cuff injuries, and then I'll talk a little bit more about how it happens and what you can do to prevent it in the long run. Okay, so you need to grab yourself some of these bands, okay? So TheraBands, stretchy bands, whatever you want to use, something that's got a bit of elastic property to it. You can grab them on Amazon for about 10-15 pounds. And then you want to grab a door like this. So my one is a loop. All right, so I can clip this on like this. Generally, the lighter the color, the easier it's gonna be. So for me, this is perfect. It's like a yellow type band is gonna be great. And I'm gonna start by pushing this on here. So yeah, yellow, pretty easy. Black is gonna be a little bit harder. So what I want to do, when you do any sort of rotator cuff mobility work, if you have a grade 1 or a grade 2 rotator cuff strain, so that means that it's not completely torn. There's a lot of work you can do on rehab to prevent having surgery. Okay, so I'll say that again. If you've got a grade 1 or a grade 2 strain, and it's not a grade 3 is a tear or complete tear, usually involves some sort of surgery. Grade 1 and grade 2 is where you strain the tendon fibers, you strain the actual tendon itself. We can rehab that and let that heal as much as we can. If we're doing that, we really want to protect the rotator cuff. We don't want to bring the arm all the way up here and start doing these movements like you see some bodybuilders doing in the gym. You want to make sure the arm is locked into the side to isolate the rotator cuff and not put too much stretch and tension on it. So really holding that elbow in tight. So if you see here, got that elbow locked in tight, and the simple movements are just doing this internal rotation here. So just pulling the arm across my body very, very gently, and I do this 15 times. If you find that's too easy, you might take a bit of a step out like this, and then just moving like that. It's going to be really, really beneficial to help just floss those rotator cuffs. So what I'm doing here is internal rotation strengthening. And then you can see if I simply just switch over to the side, I'm going to get the other side here. Now, tendency on this one is to go like that and then move. Don't do that. Keep that elbow tucked in. You see a little better here. Don't do this. Make sure that elbow is tucked in. Just moving side to side. Keep it tucked in, all the way back. Might want to step a little bit further out. Good, hold, then come back in. Hold, and then coming back in like this. Really lovely way to help strengthen the rotator cuff take a lot of stress off those areas. Okay, then we've got one for the big lifters. So you see the dumbbell here. This is a 2 kg dumbbell, so relatively light, 2 bags of sugar. You can do this with a bag of sugar at home, but I'm not going to be doing this. I'm not going to be pressing it. I'm not going to be doing any bodybuilder stuff that you see in the gym. It is simply an isolation exercise. So just take it easy. We're not trying to build big shoulder muscles here. We're not trying to be big chest muscles. We're not bodybuilding. We're not getting ready for the summer. We're looking after 4 tiny tendons that provide a lot of stability to a highly mobile joint. So again, simple exercise, same movement, just coming across like this and then going all the way back like this. Okay, same thing on this side. Again, it's a tracking, flossing movement, help nourishing the shoulder. Same from the side, you see a little better there as well. Taking pressure off. Okay, so for me, I love a massage gun as well. So massage guns are great. So you can literally just turn them on the base. The ring will go green like this. And then I turn it on to about 75%. So this is as 30 levels. This is number 18, okay? And you can simply just run it over, show you a bit closer here, the actual tendon insertions onto the joint here. And just moving it around, you do a lot of work on the bicep tendon, so that's that knobbly bit you'll feel on the front. Bicep tendon attaches all the way into the front here. And then obviously you can start moving the muscle like this as well. So it's obviously helpful if you get someone to do this for you. If you haven't at home, then you can do it yourself as well. So for the massage gun, anything from a minute to 5 minutes is absolutely perfect. You want to make sure that it's not causing any pain. If it does, just stop and let us know next time, and we can have a look at that for you as well. Okay, so these ones are super simple. You do it on the bed here, but you don't want to do it on the floor. So it's called a push-up plus. So you just want to make sure that the elbows are locked out, and do it on your knees to start with, just to get used to the movement. So you're literally just dropping the chest through and then pushing back like this. So really, really simple exercise. Just to help take pressure off the shoulder blades. It's going to relocate the shoulder blade by strengthening the muscle called the serratus anterior, which runs on the inside of the shoulder blade. Helps to bring the ball and socket joint back into a better position. Okay, that's too easy. On all fours, again, just dropping in like this, just taking pressure off those joints like that. Okay, and then final one is going to be this one. So this is a bit harder, but head down. Like this, arms back in a Superman position, and you're literally just trying to pull back like that, and then come down, pull back like this, and then come down. Really making sure to squeeze those shoulder blades, and not sort of arching the back like this. Head stays neutral, trying to pull back, hold, squeeze the shoulder blades, pull the shoulder blades down as well, not like this. You want to go down like that. And repeat, again, 15 times, 3 sets through is perfect. Okay, so if you are really worried about whether or not you have torn the rotator cuff, then that's obviously going to be a need for a surgical referral. So how do you know if you've done a grade 1, a grade 2, or a grade 3 strain? Well, generally speaking, if you can move the arm and it's sort of 30% pain, like a 3 out of 10 pain, it's unlikely it's going to be a grade 1 strain. If you're finding that it's really, really difficult to actually get your coat on, put your hand above your head and wash your hair, then that's probably going to be more sinister. It could be a grade 2, maybe a grade 3. There are 4 tendons in there. Now, they all do different movements, but if you lose one of them, there are other muscles around that area that can support that movement, which may mean that you don't need to have reconstructive surgery around the shoulder. It can rehab itself, and you can manage it yourself as well with the help of a professional. So the best thing is, I would say, is if you are concerned about it, seek help from a professional. Physiotherapist, GP can refer you for an ultrasound. The ultrasound is going to be one of the best ways to determine exactly what grade of strain you've got, and then they can formulate the appropriate plan to getting that rotator cuff healed and getting it in the best position long term. So if you like the video, please hit the like button. Please share this with anybody who is struggling with shoulder pain or a rotator cuff issue. And then you can grab copies of my best-selling books here, How to Transform Your Back and The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, on Amazon in the show notes below. Many thanks. See you next time.